There you are.
There we go. There we go.
Perfect. I don't know. I was getting this stupid echo, and I apologize, guys. I was getting this stupid echo, and I was like, "What the hell is that? What's going on?" So yeah.
Oh, that's perfect.
Thank you so much for being on the show. Because I mean, guys, I'm really kind of like stumped and scared at times because we all work in a very female heavy profession. Men, Mike, you can Mike and Blake, you can correct me if I'm wrong, because they're members. Blake is the recent president-elect of the American Assembly for Men and Nursing. Then we represent what, 6 or 9% of the profession in the field of nursing. Blake.
That's true.
That's true.
Can you? I'm having a lot of echo. That I'm trying to understand what you're trying to state. I'm sorry, Wes.
Yeah. So in terms of the profession of nursing, men basically are what, 6 or 9% of the 3.6 million nurses in the United States.
Yeah, that's correct. There's actually, it depends on what source you're looking at. There's some that state anywhere as high as 11 to 13%, depending on whether you're stating that are going into nursing school or who's actually practicing. So it's a moving target. I think we're going in the right direction, but it's definitely needs to go much higher percentage-wise, not to bring more men technically to the field, but to have parity within our profession, like as many other professions, to truly take care of our communities and represent them. As you know, anyone looks and they represent each other in regards to what they look like, the experiences that they go through and relate to. More men need to come into the profession to be able to successfully do that in the nursing profession.
Wow. Well, so yes, definitely we need more men in the nursing profession. I can vouch for myself, being a nurse for over like 16 years, and that the number has definitely gone up, and we definitely need more. But in the sense that when we talk about kind of like this whole new campaign, hashtag #Me2, and also all of the cadre of women who have come forward, in terms of like sexual assault, sexual harassment, for Bill Cosby, Harvey Weinstein, just a lot of men have really come up. Just a lot of men have really come up. We probably in life would have never thought would have been responsible for doing something. I don't want to ever in life think that I condone or support anybody doing wrong. But kind of like them being brought to justice, about what they've done, kind of alarming and anxiety provoking. Kind of alarming and anxiety for men that would raise red flags, Mike, for men to become nurses, even because you're in nurses school. I think when I was in nursing school, I think I was one of 2 male nurses students.
I think this is a very sensitive subject, but I think one of big opportunity for us as men in society. The individuals that go into nursing, you have to have certain characteristics, and those are of a set of values and principles that you stand on. and you're taken in very high regard. I mean, the nursing profession is the most trusted and highly regarded profession in the United States. And I will tell you personally, the things that have come out lately with these people in certain power positions is so unfortunate, and I think it paints a horrible picture on the what men are in our society, because you don't hear about the good, you hear about the bad. So the next step is, what do we do? Well, we as men in this profession, and men in general who are good fathers, good brothers, good sons, we need to come out and actually have a counter narrative to this. We need to stand along side by side with our female colleagues, as well as the females in our communities, and we need to put a stop to this. And I think we play a big role in that. And as a professional caregiver, to say whether it would take you and not make you want to go into the nursing profession, I would almost argue the opposite, because I want to go out and tell these men, if you want to truly do something that is of high integrity, and actually do something bigger than yourself, this is that profession. This is that chance to be held in high regard, to do the things the right way, to be a part of something that can truly impact somebody's life on a daily basis. But it's up to us as men to continue to step out and be in the limelight, and to push back, and to bring these individuals to justice, because it's getting ridiculous is not the correct word, but it upsets, I know, myself, and you too as well. It upsets me because it's not right. There's no place for it. And sometimes it takes another alpha male to put another alpha male in place. And we need to do it together, though. We have to do it together. And I feel so horrible for the victims, the females in this position, and my heart goes out to them. But we need to do something and not just stand in the shadows. I don't know what you think about that, Mike.
Yeah, so those are all good things. Can you guys hear me okay?
Yep.
Yeah. So yeah, you hit it dead on, man. But what I've noticed, and I've been doing this for about 10 years now, so I'm kind of right up with you guys. And I have not met, I can't think of one single guy who I've worked, with whom I've worked in any hospital, coming through nursing school, anywhere. I can't think of any person that I would ever think or consider someone who is in the profession for any other reason than that they truly care about people. And I think that when people who are considering the nursing profession, and I can't speak for everybody, obviously, I can certainly speak for myself. I did not even consider that, maybe I shouldn't go into this because, I'm a little sketchy, and I like to, womanize, I'm a womanizer, that kind of thing. I believe that for consideration, I believe that they feel like, it's a calling for them, or they feel like, hey, I legitimately care for people, and for all the right reasons, people, I believe, consider nursing. There's a flip side to this, right? Because men in nursing, there's almost a dichotomy where, women can take care of men in all, in all their splendor, they're naked, they're walking, whatever it is, in their most sensitive times. But when you consider a man doing the same for a woman, you have to be very careful. And I can understand that, when women come in and they're very vulnerable, they're in the, they're quite possibly the worst time in their life, because that's what, you don't come to the hospital when things are going great, right? To be cared for by a man, it's a little different, right? We do, like you said, we make up 9%, and I've seen 11% of the profession. So most times when you go in, you're going to be cared for by a woman anyway, right? And like you said, Blake, the times are changing, right? Things are moving in the right direction, for the right reasons. But as far as considering, being involved in some scandal, when you're thinking about pursuing a nursing career, yeah, I just don't think that that's on the minds of a lot of men. Was it on? Were you either of you guys thinking about this? Did you
Absolutely not.
consider? No, no, of course, because you guys, your heart's in the right place when you're considering the nursing field, right? It's not because, hey, I'm going to get a lot of chances, to hit on some women. Yeah, you know what I mean. So, and I said all that to say this. I believe that, for men who are choosing the nursing career, I don't believe that they're doing, it's going to be the kind of person that's going to do that. Albeit, I didn't think that, Bill Cosby, who would think that Bill Cosby would be involved in something like this, right?
In my head, Bill Cosby was my father.
Dude, that's Cliff Huxtable, man. It's unbelievable. That was Dr. Huxtable. It was horrible to find out.
So, Mike, you touched on the patient experience, so the male nurse to the female patient experience. But for coming from in the perspective of being a male nurse working with tons, we work with lots of colleague female nurses, and I don't know if you guys have ever experienced. We have sometimes very sensitive conversations. We work together. I mean, I'm not gonna lie. In my younger days, I worked sometimes 80 hours, upwards of 80 hours in the hospital, like 5 days, 6 days a week. So we spent a lot of time around one another. Actually, sometimes more time than we spend with our spouses. And we can tend to, like, I know you were talking earlier about, there was an event at work, and it was either a baby shower. I know it was a baby because you have a kid coming. But again, we have baby showers, we have weddings, we go to one another's, like, different experiences in life, and sometimes those boundaries can seem gray. What do you think about, like, this whole experience? Do you think that nursing is just as sensitive to now this, or that we've just kind of like have this, like, hey, we work hand in hand, and we can either check one another if we need to be checked to say, hey, that made me feel uncomfortable about what you just said or you did before we, in the locker room or whatever. What do you think, Mike, about that professional experience amongst men in nursing?
Well, you make a very good point. We do spend the majority of our life, if at least half, right, with these people, our colleagues, and it's different because what you're doing, this isn't a job like every other job, right? This is a job where you're doing things with a partner here, with your colleague on whatever unit you're at. The most sensitive of sensitive things, I mean, some people are just so vulnerable. Some people maybe they've had a stroke and they're just comatose. When I work in the ICU, we deal with a lot of patients. They're comatose. And these patients, they soil themselves, they have to have bed baths, and you can't do that by yourself. So you're working hand in hand with somebody, right? And so it's kind of wild, it's kind of like you say gray, the lines become gray. It's a tough one, man, because I've been in situations as a guy, and it's weird because usually the women in the news, you hear women say, this guy did this. Man, when I lived in Vegas, women were so inappropriate to me all the time. All right, as patients, whenever I was working in the emergency room. And so, I can totally understand how women might feel, even if it's just a little bit, because you're performing a service. This is your job. You're taking care of somebody that's sick, and then they're inappropriate to you, which happens in a number of professions. Nursing is definitely not the only one. I just read something the other day that flight attendants, they are there's a lot of that goes on in the airline industry. But as far as your colleagues go, I'm married, Happily married, and my wife is my best friend. And for someone in my situation, I don't think that line blurs as much, maybe because I just feel like I got my main squeeze, But maybe people who aren't married, maybe people who aren't, maybe they're not dating somebody, maybe those lines do blur, maybe a little bit. Some people are a little bit more inappropriate, and they're comfortably inappropriate with each other. I don't know if you've ever experienced that. Some people are just, they have a higher tolerance for, there's different levels of inappropriateness, I guess.
Right.
And I've witnessed it.
One of the things that came to mind, like I was just, I mean, and I'm not going to say where. I have a female colleague, and she has a very regular conversation with me about her period, and I'm perfectly, I'm cool. We laugh about it, and we talk about like how it makes her feel and different stuff like that nature. But I mean, that could be considered an inappropriate conversation for.
That could be
Yeah.
taboo. That it just,
Yeah.
and it really, what it depends in my experience as a married man, it depends on what my wife considers taboo. Because if my wife considers it taboo, then that's taboo, right? Because that's whose shoulders I don't want to hurt her feelings. I don't want her to feel disrespected. So I can tolerate various levels of, I could talk about that. We're medical professionals. We deal with that stuff, right? On a daily basis. We deal with those things. Like menstrual cycles, right? I mean, I feel perfectly comfortable talking about menstrual cycles to somebody. I can talk about hemorrhoids, the color of somebody's, when somebody has a bowel
Why,
movement. You talk about that,
yeah.
you know what I mean?
Yeah. While we're sitting at the lunch table, at the same time,
Yeah, right, right. So
what we're
when you
talking
say
about.
different
But
levels of inappropriateness, it just depends on how inappropriate are we talking?
yeah.
Right.
Well, and I would like to speak from a patient's point of view because I think this what's in the news right now. I think affects us as men in this profession even greater than just the workplace. I mean, um, when you approach a female as their caregiver, you're in charge of their care while they're in the hospital. I mean, you are the sometimes I think you know air controller, in and out, making sure the plan of care is going well, and you may be helping them in the most vulnerable times, going to the restroom, all those types of things. I
Yeah,
think it is so important that we as men, you have to be able to read the room. You need to have that conversation at the beginning of the shift with your female patients. They may not always come forward and say, hey, I don't feel comfortable with having a male nurse. It's your job as the professional to find out what preferences they would like to have. And I would say the same thing to my female colleagues. Men are modest as well. They're not going to tell you because that's just not the way society has taught them to do. But I've come up to men before and they're saying, I just don't, would you rather be my nurse? Because I don't feel comfortable, when I came in for something that having to do with urology and I've got a female trying to straight cath me, it's just not something I'd want to do. I've actually been in that position before, but it mostly happens with females and male nurses. So what I would tell my male colleagues is sit down, have that conversation at the beginning of shift. How comfortable do you feel? Because many of them are still comfortable with you doing the I would call the medical type of things like giving meds, talking about their plan of care, the doing patient education, all those types of things. They're totally cool with that part, but you should respect them. And everybody is different. Everyone. Don't assume anything. And but with the stigmas that out there about male nurses and sexual harassment, I mean, you have to be very careful as a male nurse because these people are will be unclothed in front of you when you have to do a lot of these things. The and almost overdoing it sometimes of making those modest changes where you're taught in nursing school, keep things covered up that you're not working with and tell them what you're doing at all times. And you should do that anyway for anybody because they're very vulnerable. But I think it's heightened, especially now that we as men have to keep our head on a swivel and be genuine in the care that we provide, so that the females can see this counter narrative that there are men out there that care. We're here. We're trying to get out and try to speak. Just in this platform right here, you know, there's a difference than these others that are out there that are, you know, personally embarrassing the rest of us. It's
It is embarrassing,
it's
right?
ridiculous. And but we need to stand up, and we need to stand right alongside. And we shouldn't be leading it. We should let our female colleagues lead this fight against this type of narrative, but know that we are standing right beside them, and when they need us to step up, we'll step up. Can you hear me there, Wes?
Yeah, sorry about that. Sorry about that. I was catching some issue with the sound that I was getting from a few people, that there's no sound, so we perfectly hear one another. But I guess it's not going out with the sound, so that's all. But yeah, thank you. You know, you're definitely, you know, you stress a very, very good point. You know, that we have to have, like, especially from the male nurse to female patient conversation. This is what I'm doing. This is the care that I'm providing, and the like, and that is so incredibly important. I I'm just recalling things such as nursing school and being told the conversation by my maternity child health, I think, teacher was like, you know, your female patients are not going to want to be taken care of, and that was really frustrating, though. That
Completely not true.
I got that. No. I got that same spiel.
You did? Yeah. Well,
Wes,
what I'm saying,
I got the
I'd say
same
from a
spiel.
patient's standpoint is completely not true, because I will say I've seen it through my cohort. There was a patient spouse who came out and asked him, you know, why can't we have a male nurse? My wife was asking, that would be a really good experience for a male nurse. Well, what we came to find out was that the instructor went in to ask the nurse if a male student could be present, and she said no, even though she said that she had talked to the patients. That's what I encountered. But I will tell you, I helped deliver 5 babies. You know, and help is a very liberal term there as a student, but
Standing there being scared.
But yeah. But it's all about how you approach the situation, but I think, like you say, Wes, it's real. That might be the most controversial time for men in nursing school. Is, you know, it could be controversial during the whole time, but the labor and delivery rotation. That is the one that's like the elephant in the room. And our second baby that just was born 2 months ago, we had an opportunity. The instructor came in and said, "We have nursing students. Would you like to have a nursing student?" And then she said, "Male or female?" And I just glanced at my wife, you know, and her knowing the position that I'm in the American Association for Men in Nursing, you know, I said, "It's your call, but this doesn't get to happen for many male nurses." And she's like, "You know what? You know, we're going to a C-section, you know," but she goes, this is important." And she, you know, of course she's very vulnerable, and she knows that I'm in the room, and her and I are like Mike and his wife, you know, we're best friends. My blinders are up when I go out of the house. She doesn't have to worry about a dang thing. I'm kind of blind to those things because I'm with the love of my life. And so I think that, you know, she's just a very strong woman, and she gave that opportunity to that male nurse, and that is just such a beautiful thing. And because they need that to practice. That's the only reason they're there. And they're there to take the best care of you. And many times when I was a student, I didn't only focus on the mother. This is a family thing. And you could see the fathers, many of them, especially the first time around, they're like huddled in the corner, scared and freaked out to death. And to have another male in that room to get them up there and be the dad that they want to be, that's a beautiful thing too. And that's what I got out of it. I loved the labor and delivery rotation, but I completely agree with you that it's that elephant in the room in regard to, you know, whether males get that experience. But I definitely
Well,
understand the
I have to
vulnerability.
say, I think Wes and I had the same instructor. We didn't, I didn't spend a lot of time with the ladies in the maternal child rotation, and that's fine. It all worked out, you know. But back to as far as feeling that your patients they need to be comfortable. That's absolutely the case, and I think every guy knows that, right? I've never, again, I've never worked with a guy who felt like, I don't know, like he didn't need to calm a patient or kind of provide that little touch of the little extra touch at the beginning of the shift. Say, hey, listen, no matter what, your comfort is my biggest concern. Let me know if there's anything I can do that'll help you be more comfortable, and if that's even just getting a female nurse in here for you for some special time that you might need. Everybody that I've ever worked with does that. There's no kind of assumed I can do all this stuff and I don't need any help, and you're not going to need any help because I'm good. That kind of. I've never seen that. I guess that doesn't mean it doesn't happen. I've never worked in all the hospitals. I don't know all the nurses, but all the ones that I have, it's been really nice. And and it's not a big deal. For honestly, for those of you guys out there that are paying attention, that maybe you're considering going into nursing, it's really not that big a deal. I mean, like Blake said, most people don't care. Most women are fine. And I've only maybe a handful of times, and out of 10 years, maybe a handful of times, that I can recall them saying, I would prefer a female being in here. I cannot think of one single time, but there has to be at least a number of, just maybe a couple times that it's happened, but I can't remember them. And but I know I know they've happened. But it's just not that big a deal now. I have. Let me tell you though, there was a story when I worked in Vegas. There was a guy who went in to do an EKG on a female patient. And this patient was, I believe it was a homeless patient, and I believe this patient was not on her medications. And he went in there with a female respiratory therapist. And she claimed during his EKG that he was inappropriately touching her. And during that shift, the cops were called, and he was escorted out in handcuffs. And the respiratory therapist said he did not do what this woman is saying that he did. And his license was suspended for 1 year, and he had to stay. He was flipping signs on the street corners just to make ends meet. So ever since I heard that story, man, I am on my P's and Q's when I go into a room, and I always make sure that there's a second person in there, in which his case, it didn't even matter. But I'm always, I try to, buy the book. And sometimes women don't understand that. Women nurses, they're like, dude, just go in there. I'm like, you just don't understand, because you're not in this position. You can go in and take care of males all day, and you don't ever have to worry about them calling the cops, right, and saying that you're inappropriate. Whereas a male definitely does. So, there's kind of a double standard, but it's not so so bad that it would sway me or make me consider pursuing a different career or put myself in situations or not put myself in situations. It's just one of those things, man. It's just one of those things you gotta deal with as a male healthcare provider.
Yep.
There's plenty of doctor OBs,
Mm-hmm. Right.
that are males, right? I mean, I would like to know, and up until this point, I haven't considered what's the number of male OBs to female OBs. I would be so curious to know that information. I'm sure we can find that out pretty quickly, but
Is there any what's the question basically, other than about the demographic?
yeah. So is there a double standard if women are choosing male OBs, right?
Right.
Because that's
exactly.
a very sensitive situation that they're putting themselves in. Why would it be different for nurses, male nurses?
Mm-hmm.
It's
Well,
just a
I
thought.
mean,
just a
yeah.
thought.
That's an idea. It's so funny. I remember this research about like 5 6 years ago where they brought in like several children, and the children identified like who was the nurse and who was the doctor, and overwhelmingly, because we all wear scrubs, overwhelmingly the kids picked the female as the nurse, but could not believe for whatever, couldn't conceptualize that the nurse was that the male in the picture was the nurse.
Yeah. Well, you'll see
That's
even
crazy, right?
you go into
That's so
rooms
crazy.
all the time. We go into rooms all the time, and you go to walk out, and they're like, "Oh, thanks, doc," and you're like, "No, I." You have to stop and say no, and
Right.
I'm proud to tell them I'm their nurse. I see what docs go through on a daily basis, not being able to have that time with the patients and all the charting. I
Right.
mean, I don't have too much sympathy on the charting part because we as nurses probably have the most charting out of anybody, but they have more patients to see than we do, though. So they've got to be writing notes and write notes and write notes after writing notes, and we just have a lot of clicks to happen, with what we're doing. But it happens all the time. You come in a room, they're like, "Oh, the doctor's here," and you always have to correct them. And though we're all a team, so I can see how it blurs, and that's why a lot of health systems are going to color coded scrubs as well. Is that you can identify people within the health system so much quicker, and especially in the hallway. Now you can debate whether that's a good or bad thing because you got family members like chasing down the hallway for inappropriate things sometimes, so you can never see the other patients. But we should be proud as men to say that we're a nurse, and make sure we correct them, and make sure that the image of men in the profession is one of high integrity, just like the nursing profession should be overall and is. And and not be so combative in trying to push back. I think we as men in a female dominated, or traditionally dominated field compared to what society is. I'm not going to sit here as a white male and say that, oh my gosh, I'm being so discriminated. I have such an uphill battle. I mean, that's ridiculous. I have so many privileges in life that if this is one, that I may not be in a privileged position, I have nothing to complain about. And what I should be doing is trying to identify how I can utilize myself to find new ways to help men break down barriers with my profession, because it might help identify other areas that I could share with my other colleagues that are in minorities and women, so that I can help them do it outside the nursing profession. I think we need to play a role in that as Caucasian males. That's yet another thing that I feel very, very passionate about, is that just because I will never know what someone has gone through, that doesn't mean I can't try to help. And it's just something that we need to do.
Right, you're very right about that, Blake. Thanks for sharing that. I know, guys, I have kept you guys on for quite some time. We are going over to a different sign in, so I want us to be okay with coming back to this if we can. In the future.
Absolutely.
Yeah.
Yeah,
of course.
absolutely. We'd love to talk about it. I think it's something that's very controversial. It's something that needs to be talked about, and I'd be very curious to know what your listeners are saying, and you'll know that Mike and I are very transparent people, but we're very open people, and I know we're not the only ones, and so we're willing to break down, and get vulnerable ourselves. To have these difficult conversations.
Interesting enough, my listeners are saying they can't hear any audio, so I have no idea. Exactly. So I have no idea. I've been like sitting here, like looking at this thing, trying to play with like what, like I hear everybody and everybody.
Yeah.
I hear all the things going up. And I'm like, I don't know. It's falling apart. So it's 8:58. We're going on at 9. Thank you so much, Mike. Thank you so much.
Hey, man.
Definitely
Thanks for having
feel
me.
free to say anything. I don't know if people can hear it. It says that it's I don't know. I'm clueless.
Hey, we'll figure it out. We'll do it again if we have to.
Yeah, we'll do take 2. we'll take two
Exactly.
if we need to. You know.
Sounds good. Thank you so much, guys.
All right.
Yeah,
Take it
we'll
easy.
talk to you
Thank
soon.
you.
So let me take this stuff off of here. I don't know what's going on. I don't know why I didn't show. I don't know. Hopefully we can shoot this all over again and do for you guys. If you can hear me, I'm sorry. Love you. Dancing,